I too will have to figure, can you hear me? Okay, I'll have to figure out how to operate this, I guess, a little bit. So I guess forward. But good morning. First, I want to thank you for allowing me to be here. It certainly is a pleasure to present at this forum. The first thing I did is I actually called Tridec and said, hey, can you send me the last several years worth of healthcare presentations, because we kind of rotate this amongst the hospitals. And so they sent them to me, and I went through them, and it's really pretty amazing when you look at them and say how much things stay the same and how much things really do change. And so the healthcare industry, I think, as you've heard this morning, is certainly an important part of our community. And what I want to do today is just talk a little bit about some of the things that you've seen in the past, and then I want to kind of boil it down to our local community and talk a little bit about the growth and where we've been. And I think that growth is going to continue without question, and I think you're going to see that it's pretty significant. I also want to let you know that when I get to statistics, it's really only our 3 hospitals that I'm including, and because that data I can go get, not easily, but I can go get it. But we have a lot of other organizations in this community that impact healthcare. We still have a fair number of independent physicians out there. We don't have their information. There's independent facilities, from nursing homes to assisted living facilities, memory care facilities, surgery centers, imaging centers, community health centers, laboratories, cancer center. There's a lot of things out there that's integral to this community that's in the healthcare sector that I won't be showing you numbers on, because I just, I couldn't get everybody to give me all of their numbers in fairly short notice. But just understand that healthcare is very significant for our community. Now let me see if I can get this thing started. Whoops. I guess I went backwards. Increasing demand. I mean, this is something that we've heard about a lot in the past, and I think when we get into the statistics, you will see that demand at our hospitals have continued to increase. We're also beginning to see and have continued to see that the patients in the hospitals are really more complicated and sicker than they've been in the past, and I think that trend will also continue. There's probably 3 reasons for that in the Tri-Cities. One is our population is growing. Our population is aging, and the Affordable Care Act, or the has also allowed a lot of folks who didn't have insurance before to have insurance, and I think that those 3 factors have really contributed. Affordable Care Act, some of you would probably call this the Unaffordable Care Act. It's reality. I think it has its pros and cons, certainly on our industry. We've seen a lot of folks who were uninsured who now have been able to get what we call state subsidized health care, or the Medicaid plans, and that those programs actually pay us less than what it costs to deliver the service, but at least we get something instead of nothing, which is what we would get in the past. We've also seen a shift of folks, and this we expected, and I'm not sure we can really put a precise number on it, where folks have actually transitioned out of the commercial insurance into the subsidized plans. So we went from where we were actually, because commercial insurance is where, I think if you talk to any of the hospitals, that's really always where we have been able to make up the margin for the Medicare and Medicaid. But we have seen a shift of some folks out of the commercial insurance into these state subsidy plans. I think that, I don't think those are going to continue necessarily, but I think the balancing act there has happened, and it has produced both positive and negative results on our institutions. Population health. You know, the way we've always delivered health care, and I know when I went back and looked, this has been in every presentation we've made, is it's been a episodic fee-for-service type business. That trend is still there today, but we are beginning to see the shift to what we call population health, where organizations will be asked to take care of an individual for a set amount of money and take care of all of their health care needs. I think that will change how we deliver health care, undoubtedly, in the sense that we'll be trying to focus a lot more on the health of individuals and really putting in wellness programs and stuff. And unfortunately, what we've seen in the past, there's very little resources that have been poured into the wellness programs. I think you're going to see a little bit of more of that in the future, certainly as we have to take responsibility for the health care of these individuals. Also, there is these things called accountable care organizations, or ACOs. These are being formed or have been formed and will continue to be formed because there has to be some contracting mechanism to contract with either large employers or insurance companies who will basically receive the money and then distribute it out. I mean, it's sort of like another insurance company in some respects. And obviously a lot of the providers are trying to be very active participations in these accountable care organizations, and how do we get the middleman out of the equation? Because we all know that healthcare cost has been increasing fairly dramatically. Consolidation. Healthcare businesses are certainly getting bigger, and I think less locally focused. I think that's true nationally. I know we've talked about it in the past. I believe that trend will continue. But at the end of the day, getting bigger may be better in some respects and may not be better in some respects. But in the world we live in today, healthcare is becoming bigger and less locally focused. Electronic medical records. This has been a huge push trying to make sure that organizations and patients have the ability to essentially have a seamless transition from provider to provider, facility to facility, and their health record goes with them. There's been a lot of effort and focus, a lot of money spent on this. I think we have made some progress, but I have to tell you, I think the results today probably aren't nearly where we had all anticipated they would and had hoped they would be. We're not talking to each other as diligently and as seamlessly as we should. But this will continue to be a focus into the future, because having a patient be able to carry their record with them, or institutions access their records, prevents duplication of services that was done somewhere else 2 weeks ago. And so we have to make sure that this happens. And I think all in all, it'll be better care for our patients. The focus on quality and outcomes. There's no doubt that healthcare has always been focused on quality, making sure we deliver a good service. And now we're looking at the outcome of the patients, which is producing a lot of things that a lot of people don't like. But I think at the end of the day, when we put in these evidence-based practices for our physicians and our providers and our organizations, what it does is it gives the patient the benefit of having what is proven to be the best practices across the country. And that's really how there's a lot of focus on paying organizations now based on getting good outcomes and delivering good quality. That's going to continue and enhance. And it's really a challenge in our business, because as the drug formularies expand to 60,000 drugs, I mean, how does a doctor keep up with what drug works where, right? And I think what we're trying to do is make it as evidence-based and as consistent as we can, so that the patient with congestive heart failure gets the same treatment every time, and it's the best treatment they can get. It doesn't always mean the outcomes are going to be the best, because there's always things that happen, but I think we're given the best shot to make our patients healthier and get better outcomes. I think probably the greatest thing that we've seen in the last few years in the Tri-Cities, in my estimation, is the development of our medical residency programs. The fact that we now have both Trios and Tridec, who have primary care residency programs where we're actually training physicians for the future and for this community. And the studies have all shown that if these young medical students get their training in a community, there's a high probability that some of those will stay in the community. And I think this is undoubtedly one of the most significant things that the hospitals have done. And Lourdes, while they don't have a residency training program, they certainly participate and support. I know they do Trios, and I suspect Tridec's training program, and we use them for rotations and have our students go over there and our residents go over there and get some training with their physicians and providers. So this is going to be a huge thing for the future. We have now WSU putting in a medical school. We have the Pacific Northwest University Medical School in Yakima. And frankly, if we don't get more residency slots, having those medical students is really not going to be necessarily a win. We have to have places to train them. And I'm very proud that both Tridec and the Trio stepped up to the plate over the last couple of years and put in these residency programs. I think that's going to be huge for this community. Let's turn our attention to growth a little bit. I have a few slides in here. These slides were taken from the state CHARS data, and like I said, these slides do not include anything but our 3 local hospitals. The 2015 numbers is really a little bit of a projection because I didn't have the last quarter in the state CHARS data, but I think it's safe to say that our healthcare economy from a volume standpoint is still pretty healthy in the Tri-Cities. Our admissions, and this is people that get admitted to your hospital, our admissions are up about over the last 5 years, up 2.5% per year. Pretty much in line with our population growth. That would be expected. We've seen these numbers in the past be up a lot more than this, but I think that we will continue to see our admission trends growing. Revenue, somebody says, well, revenue doesn't mean a lot, but if you don't charge revenue, it doesn't ever get to the bottom line. And so one of the things that I wanted to look at, the total revenue. Now, this is both our inpatient and outpatient revenue, our ambulatory revenue. The Tri-Cities 3 hospitals now produce just over $2 billion of revenue a year. And the average increase over the last 5 years has been about 17%. Pretty phenomenal. Now let's break that down just a little bit differently and look at inpatient revenue. The inpatient are people that are admitted to hospital. That has not grown quite as much as our overall revenue. Still a nice growth, 10% a year. And I think the reason it's up 10%, our admissions up are 2.5%, part of it is I think that justifies and verifies this whole concept that the patients we treat in the hospitals now are more complex, sicker, use more critical care services than they did in the past. And so, but it's still a very nice growth trend. Now this is outpatient revenue, and I think this number is pretty phenomenal and something we all need to get our arms around. The ambulatory revenue, and that's why there's a lot of other entities out there now that are, I don't want to say competing with, but providing ambulatory services. Most of those other organizations I mentioned earlier, they're in the ambulatory business. But that revenue is up 24% a year. Pretty significant. And I certainly believe that this trend will continue into the near future. When you have growth, you have to have people to take care of those patients, and there's no doubt that our employees are our most critical assets in our organization, because without good employees, there's nothing that we can do to take care of these patients. And certainly from Trios's perspective, we have great employees. I know that Catholic and Lourdes both has great employees. So, we're pretty fortunate in that arena. But the growth here has been pretty tremendous. And, it kind of bounced around there for a few years. And I think that's when everybody was trying to figure out what they were going to do a little bit. But in the last 5 years, we've seen our labor and benefits, our salary, wages, and benefits increase at about 14% a year. Expansion projects or construction projects is another area where, you hear a lot about where that's really a contribution to your community. And I know I've been here 11 years, been privileged to be here 11 years in the Tri-Cities, and probably not a year that all 3 of the hospitals haven't been doing some kind of construction project. Some are bigger than others and some are smaller than others, but if you go back just the last couple of years, we've spent over $200 million on construction projects. And I don't know if those sales tax things that Barb was putting up there included the construction and that stuff. If it did, I can tell you that our little hospital paid a whole bunch of that. So, and I think that's good. I mean, it helps us reinvest in our community. So construction has been very vibrant in this community from the healthcare perspective. I certainly believe that will continue, at least the indication I've gotten from my other 2 peers. I can tell you, Trios doesn't have a whole bunch immediately on the board because we kind of spent a whole bunch the last couple of years. But talking to Lane and John Searle, clearly our other 2 hospitals do have some significant construction projects on the board for the next 2 to 5 years. And so you're going to continue to see the Tri-Cities healthcare scene grow, both in terms of labor, employees, which is reinvesting in the community, and providing new facilities and expanding existing facilities. So with that, I just want to let you know that from my perspective, and I appreciate what Carl said, I believe that healthcare has certainly been a very vital part in making the Tri-Cities not only a great place to live and a great place to work, but a great place to play, and I think that will continue. So I want to thank you for having me here, and thank Carl, and welcome any of you to come look at our new hospital when you want to too, please.